Now, Kenya is today joining the rest of the world in observing World AIDS Day. Now, this World AIDS Day, the theme is End Inequalities and AIDS, with a special focus on reaching people left behind. And its partners are highlighting the growing inequalities in access to essential HIV services. HIV remains a major public health issue that affects millions of people worldwide. Although the world has made significant progress in recent decades, important global targets for 2020 were not met. Division, disparity and disregard for human rights are among the failures that allowed HIV to become and remain a global health crisis. Now, COVID-19 is exacerbating inequities and disruptions to services, making the lives of many people living with HIV more challenging. And of course, I want us now to speak to Dr. Cornelia Ochola, who's a Senior Technical Advisor at the Center for Health Solutions, on just this World AIDS Day with keen focus on the theme this year on ending inequalities. Dr. Ochola, thank you very much for joining us this morning here on News Center. Let's just begin with the theme we're working in this year, even as we mark the World AIDS Day, End Inequalities and AIDS. Bring it back home. What does this mean for us? How do we go about it?
Thank you so much for having me. As I said, my name is Dr. Cornelia Ochola from CHS Kenya, and the theme is very timely, end inequality and AIDS and pandemics. With HIV, there has been definitely inequalities worldwide. There are certain populations that are unreached or are not reached as much as you would have wanted it. For example, the female sex workers, the men sex workers, male who have sex with men, adolescents and children. So we need to do a little bit more to be able to ensure that they are able to get these high quality HIV care and services, from prevention, treatment and care, that we are able, early diagnosis, treatment and care, so that we are able to end this HIV pandemic. So it's very timely. A lot has been done. We have moved. If you compare where Kenya was 10 years ago and now, the pandemic has really changed from prevalences of above 10% to the current HIV's estimates of 2020, which was at 4.5%. That means something has been done. There has been a lot of improvement. But now we need to move a little bit more and also give increased support to what we call the key populations, the ones who face the inequalities, so that we are able to end this pandemic.
Let's just bring it back to 2020, when the COVID-19 pandemic struck a lot of countries around the globe. And this has been seen to really disrupt a lot of efforts that had been already put in place in the fight against HIV. Talk to us about that. How bad has this made the situation, and how do we work towards improving or ensuring effectiveness from where we are? How do we undo the damages that were done during the COVID-19 period?
Yes, definitely during the COVID-19 pandemic, as it began and progressed, there were a bit of challenges in the healthcare system in general, not only in the HIV world. But one thing I must commend the Kenyan government is that the government took it by stride, and policies and strategies were set in place under the leadership of the Ministry of through NASCO and the donor world and the implementing partners, to ensure that those patients who required HIV services received them. Some of the challenges that were there, if you were to mention, for example, there were lockdowns, so the movement restrictions. What we'd see is that patients who were set to have their clinic appointments to get their treatment, there was some movement restrictions, so they were not able to reach their facilities. With that, there are also transportation hikes, so patients are not able to afford the high transport costs to be able to get to the health facilities. Other challenges that were there, certain health facilities had to be closed down and made into isolation centers. And that's were some of the challenges that we faced. However, I think what I know is that through the government, we were able to come up with strategies very fast that were able to mitigate this. And so our country didn't really go through, we were not set back too much. some of the things that we were able to do was that patients were given longer appointments to get their treatment, and so more medications. If a patient was to come to the facility for every month, now they were asked to come at least every 3 months. So they're given 90-day medications, and that enabled them to at least not have to come to the facility so frequently. Another thing that the government did was that patients who were being seen in facilities that were made into isolation centers were quickly moved to other health facilities, and that was communicated to the patients early enough. And so they were able to know where they're supposed to get their medication, and with that, services were not really cut off. Another thing that also the government was able to do through the ministry, and it cascaded down to the health facilities, was to ensure that the healthcare workers were trained on infection prevention and control, and also PPEs were provided through the county governments and through also the national government. So we were able to provide PPEs, infection prevention training, and so the healthcare workers were not afraid to see the patients, and also the patients were now being confidence to come into the health facilities improved. To remember, when COVID-19 struck, one of the things that happened is that people were afraid to go to hospitals because they were thinking once they go to a hospital, they would get COVID-19. And that was the same for HIV patients. But we had to build their confidence and tell them, if you're able to maintain our infection prevention within the facilities, that would work. So other things that hospital facilities did was to stagger their appointments. So patients were allowed to come to the facility through the whole day. And so one is told you'll come at 9, another person will come at 9:15. There was the maintaining the Ministry of Health COVID-19 guidelines within the waiting areas. And with that, confidence developed and services were not interrupted as people had highly anticipated.
But the even with some of those interventions that have been put in place, the prevalence rates in the country are still worrying, and the world is gearing towards, we're having a conversation about ending AIDS by 2030. Will we really meet these targets? What are the missing links that we need to plug into for us to realize, or for some of these efforts to bear fruit by then?
And that's why we have the theme of ending inequalities. Some of the key drivers to the HIV pandemic is the kind of the services that are offered to the key populations for them to know. First of all, just training the healthcare workers in the facility so that they're able to see patients who are within these key populations that I had mentioned before, the female sex workers, male sex workers, men who have sex with men. Ensuring that when they come to the facility, they don't face stigma and discrimination. So they're able to come to the facility and they're able to get preventive services. Those who are, they're able to get preventive services, diagnosis.
All right, we seem to have a problem with that connection. We'll try to sort that out shortly as we continue to speak to Dr. Cornelia Ochola, who's the Senior Technical Advisor at the Center for Health Solutions, talking to us, and especially on the theme this year on World AIDS Day, on ending inequalities, ending AIDS, and what are some of the interventions that we need to put in place. She was just talking to us about some of the vulnerable groups, if I could call it that. And of course, once we get back that link, she will be able to finish that point, especially on whether the world is really likely to meet the target of ending AIDS by 2030 and what needs to be done. But even as, all right, I'm told that we have Dr. Cornelia Ochola back. My apologies for that hitch there, technological hitch there. I'll let you finish the point. You were talking to us about some of the groups that are facing a lot of discrimination around this. And if we're talking about inequalities, then these groups have to be given priority at this point. So then talk to us more about the interventions, where you stopped it out from.
So just ensuring that our key populations are able to receive HIV preventive services, HIV diagnostic services. They're able to also receive those who are found to be HIV positive receive quality care and treatment. Another population that is really being looked at are the adolescents, to ensure that we're able to provide adolescent responsive services within the facilities so that these adolescents are able to come and get tested, and those who are tested get preventive services first, so that we have risk reduction, we have ensure that they are tested, and those who are found to be positive also get quality care. One thing, another population that I am really close to my heart and I wouldn't want to forget is preventing mother-to-child transmission. This is just ensuring working together with our community partners, ensuring that every pregnant woman comes to the facility early, at least within their first trimester, to get their HIV tests done, and ensuring that all pregnant women know their HIV tests. Because if a pregnant woman knows their HIV test, if they are positive, they start the virus in the body is low, then we know that transmission to the child is very low. And also when the child is born, they are delivered by a skilled healthcare worker and provide access. And it's also to reduce newborns.
All right. Before that technology lets us down completely, thank you very much for joining us, Dr. Cornelia Ochola, who's a Senior Technical Advisor at the Center for Health Solutions. We appreciate your time and your insights this morning, even as Kenya joins the world in marking the World AIDS Day, with the theme this year being End Inequalities, End AIDS. Is a story that we continue to keep an eye on. Our Health and Science Desk is on it, so we'll continue to keep you up to date with the same. But away from matters health, I want us to head to the coast and focus on Kaya elders who play a critical role in shaping the political landscape